Hello, my name is Sincere, and today I'll be discussing nursing care for LGBTQ plus patients, focusing on the unique health disparities this population faces and how nurses can help create a more inclusive and supportive healthcare environment for these patients. Moving on to slide 2. In this presentation, I'll provide an overview of the healthcare disparities that LGBTQ plus individuals experience and why it's important for healthcare professionals to be aware of these issues. As nurses, we're primary caregivers. We have a significant role in creating a safe, inclusive space for all patients. So our goal today is to explore health disparities, the impact of discrimination, and how we can improve care through actionable strategies. Moving on to slide 3. One of the major challenges LGBTQ plus individuals face is a higher incidence of mental health issues. Due to societal stigma and discrimination, they are more likely to experience anxiety, depression, and suicidal ideations. Studies have shown that LGBTQ plus individuals are 2 to 3 times more likely to suffer from mental health conditions compared to their heterosexual peers. In addition, substance abuse is more prevalent, with higher rates of tobacco, alcohol, and drug use. Another challenge is homelessness, with up to 40% of homeless youth identifying as LGBTQ+, mainly due to family rejection. And lastly, many LGBTQ+ individuals face barriers to healthcare, including fear of discrimination, judgment, and lack of knowledge from healthcare providers. Moving on to slide 4. LGBTQ plus individuals have specific healthcare concerns that require targeted health care. For example, sexual health is a significant issue with gay and bisexual men and at higher risk for STIs, including HIV. Lesbian and bisexual women, on the other hand, often receive inadequate reproductive care. Chronic diseases are also more prevalent in this community. Lesbian and bisexual women have an increased risk of cardiovascular disease, while LGBTQ individuals generally face higher rates of obesity and diabetes. For transgender individuals, healthcare becomes even more complex, as many face difficulties assessing gender-affirming hormone therapies and surgeries. Additionally, the lack of social support can elevate mental health issues. Moving on to slide 5. There are several barriers that prevent LGBTQ individuals from receiving proper health care. One major barrier is the lack of provider knowledge about LGBTQ plus health issues. Many healthcare professionals are not adequately trained in these areas, which results in suboptimal care. Stigma and fear of judgment also play a major role. Many LGBTQ plus patients delay or avoid seeking medical health care because they fear being discriminated against or even judged by healthcare professionals. This creates a significant challenge for both the patient and the provider. Moving on to slide 6. Nurses have a critical role to play in creating a welcoming and inclusive environment. One way we can help is by ensuring our practices are culturally competent. This means being educated about LGBTQ plus health concerns and approaching all patients with sensitivity and respect. We can also advocate for better training for healthcare providers, ensuring that all staff are educated about the needs and rights of LGBTQ plus individuals. Also, building rapport and trust with LGBTQ plus patients is crucial so they feel safe sharing their healthcare concerns without the fear of discrimination. Moving on to slide 7. Improving care for LGBTQ plus patients involves several key strategies. Firstly, healthcare professionals must create an open and non-judgmental space, right? This can be as simple as using inclusive language, such as asking patients about their preferred pronouns. Also, we need to advocate for policies that support LGBTQ plus individuals, such as including sexual orientation and gender identity in health records. Third, nurses should educate themselves and others about LGBTQ plus health disparities and work towards changing institutional policies that may harm this population. Lastly, it's important for nurses to recognize and challenge their own biases to ensure that LGBTQ plus patients are treated with dignity and respect. Slide 8. We have reached our conclusion. Addressing health disparities faced by LGBTQ plus individuals is a vital part of providing equitable care. Nurses can make a significant impact by creating an inclusive environment, advocating for LGBTQ plus rights, and improving cultural competency. By understanding and addressing the specific needs of this population, we can help ensure that all patients receive the care and respect that they deserve. Here are the references used in today's presentation. These resources provide further information about LGBTQ health disparities and offer valuable resources for healthcare professionals looking to improve their knowledge and practices. I hope you check some out so you can start advocating for some LGBTQ plus patients. Thank you for listening.